The COVID-19 pandemic significantly disrupted the healthcare industry, affecting hospital project planning, design, and construction. The Elliot Hospital Emergency Department project found itself at the epicenter of such disruption, where merely 2 weeks into mobilization, the project was brought to a standstill. During the downtime period that spanned a full year, Elliot Hospital strategically capitalized on this unexpected pause, leveraging their firsthand experiences to reassess, rethink, and ultimately reimagine their project.
We had to take a pause and kind of reevaluate what we were doing. During that time, it was very difficult to understand what the current state of healthcare was because it was so dynamic. It was changing every day.
This is sort of unprecedented times, and there were no standards to deal with these things, and so we had to work as a team to kind of solve those issues.
So we focused primarily on HVAC because that was one of the key drivers during the FDC guidelines on increasing airflow to spaces and reducing particles in the air and so forth.
Through the plan, what we prioritized was the ability to create cohorts of patients based upon concern around airborne and contact infection. So what we're able to do is basically isolate certain areas of the department specific to those concerns and keep patients safe with separate exits and entry and without commingling.
We decided to flip the RTT and waiting area. The RTT area was forward-thinking. Patients would be able to come in, be seen, and not have to exit through the same area and mix pandemic patients with healthy patients.
In order to meet COVID provisions, several things needed to change with respect to the design. The first thing was the air handling unit and the increased outside air fraction. That cascaded down to an increased air-cooled chiller design. Also within the air handling unit, we added UV filters to combat growth on the backside of the cooling coil as well as airstream pathogens. And we also added increased MERV final filters, effectively equivalent to what you have the KN95 mask that people were wearing.
We continue to see an increased volume of patients presenting to the emergency department. We've been able to continue to handle those patients. We've created bigger care spaces, more privacy, and a model that reduces waste for the care team and providers that are working in a hub and spoke model.
In June of 2023, exactly 1 year after its intended opening, the Elliot Hospital ED was unveiled, ready to serve the more than 55,000 patients who will seek its services each year.